In this presentation, we are going to help you identify the signs and symptoms of COVID-19, which are updated on a regular basis by the Centers of Disease Control and Prevention. If you take a look at the graphic on the right, you can see where the name of this new disease, COVID-19, originates. The CO stands for corona, VI is for virus, and the D is for disease. 2019 is the year it was discovered. Most of the symptoms of COVID-19 are similar to the flu. The symptoms listed here, such as fever or shortness of breath, can range from mild to severe. According to the Mayo Clinic, symptoms in a typical COVID-19 case can start like any other illness, with fever, dry cough, and fatigue. Some people have no symptoms, and others have more unusual symptoms, such as shortness of breath, difficulty breathing, muscle aches, chills, sore throat, headache, and chest pain. For most people, the disease results in a mild illness, but for others, it can be severe and sometimes fatal. COVID-19 may cause mild gastrointestinal symptoms, including loss of appetite, nausea, vomiting, and diarrhea. These symptoms may only last one day. Some people with COVID-19 have diarrhea and nausea prior to developing fever and respiratory symptoms. COVID-19 may also cause a new loss of smell or taste without nasal congestion. This typically lasts 9 to 14 days. Some research suggests that loss of smell or taste might be an early predictor of COVID-19. In older people, COVID-19 also has been reported to cause confusion, especially those with severe infections. Finally, COVID-19 might cause eye problems in people with severe infections, including large red blood vessels, swollen eyes, excessive watering and discharge. As a result, this could create light sensitivity and irritation. In order to prevent the spread of COVID-19, avoid touching your face, use a facial mask, maintain 6 feet of social distance, practice routine hand washing, and avoid others that are exhibiting symptoms. It is important to monitor ourselves and others for symptoms. If you notice symptoms, a simple temperature check will determine if you have a fever, which means you should contact your medical provider or get tested. Because symptoms are similar to many other illnesses, tests are needed to make a diagnosis. Testing involves a nasal swab or blood test. Mild symptoms can be treated with medicine to lower the fever or relieve pain. If symptoms are more severe, treatment in a hospital may be required. Every day, medical professionals are learning new ways to better treat this disease and improve outcomes. If you or your child exhibit symptoms, please call your medical provider. The important thing is, students who are sick should not go to school, potentially spreading the disease to others. If you or your child is getting tested, isolate from others until the results of that test are known. Until you are tested, the best advice is to stay in touch with your medical provider, avoid transportation in other public areas, avoid sharing personal items, and clean high-touch surfaces. In another important development related to COVID-19, parents and teachers should be familiar with multi-system inflammatory syndrome, or MIS-C, a rare condition in children. Although MIS-C is very rare, it is important to be aware of the symptoms, which include fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, fatigue, cough, sore throat, and shortness of breath. You should immediately seek emergency medical assistance if someone has trouble breathing, chest pain, new confusion, an inability to wake or stay awake, or bluish lips and face. These video resources provide excellent information if you're interested in learning more.